Hello. Hi, friends. Good afternoon. Thank you all so much for being here. Life in Transylvania County has been a little heavy, right? A little interesting. But thank you so much for taking the time to be with us, be with your neighbors, your community, and showing up for yourself today. It's really important. Just as a reminder, if you could please make sure your cell phone is silenced. We are recording this, so those who cannot be here, you can send it to them in the weeks ahead. All of the resources, books, and videos and authors you'll hear Dr. Wells speak of today will be available to you at the conclusion of the event. So don't worry about writing anything down. We've done that work for you. So, I think we're ready. Please help me give a heartfelt welcome to Dr. Ora Wells.
Welcome to this community call for action. A wise person once said, your health isn't everything, but without your health, everything is nothing. The overall health of the brain and its ability to function effectively, including memory, learning, and problem-solving skills, is essential for overall well-being and can be supported through lifestyle, including proper diet, exercise, and mental stimulation. Tonight, I want to spark your awareness of the choices that we make to either threaten or protect our cognitive health. Thank you, Brevard College Education Department, the Brevard College Teacher Education Department, especially Betsy Burrows, wherever you are, for making this venue available. And thank you to my Spark Point team, Sarah Hankey and Charlotte Shackelford over there in the corner, and my board for making this possible and for facilitating the meeting. Now, the question is, I am not an expert. I'm a pediatrician, for heaven's sakes. I'm a 73-year-old retired pediatrician. So how can I presume to talk to you about cognitive health? Well, I want to tell you that I'm not suffering from my minimal cognitive impairment, but I'm learning to live with it, okay? And I want you to know what you can do in your own path along this route. So what is Alzheimer's disease? Well, it's the most common form of dementia. It accounts for 60 to 70% of dementias. It's a gradual loss of memory and cognitive decline. Oftentimes, once you're diagnosed, it may be a 5 to 8 year slide into dementia. And then oftentimes death follows 8 to 12 years later as you lose progressive bodily functions. It's one of several things. You'll hear about frontal temporal dementia, vascular dementia, Lewy body dementia, and then there's early onset Alzheimer's. I have late onset because I was diagnosed at 72 years of age. Late onset is if you're diagnosed after 65. There's a very rare form that only accounts for 1% of early onset Alzheimer's. And these are associated with 3 specific genes, okay? But that's not what we're talking about tonight. Some memory problems may be related to reversible causes, like thyroid issues. One of my first patients when I was a medical student making rounds in Augusta, Georgia, was a veteran who had profound hypothyroidism, and he couldn't speak. And they thought he had dementia, but it was his thyroid. And once we corrected that, his dementia went away. So there are treatable forms of what looks like dementia. So if you have concerns about your cognitive health, see somebody, be checked, and see if you have a treatable form. And if it's not treatable, there are things you can do to improve your lifespan. Some of these include vitamin D deficiency. Depression can look like dementia, okay? So you want to see your doctor early and talk to them about your diagnosis and what treatment might be available. The big myth about Alzheimer's is it cannot be prevented, treated, or slowed. We're going to address that tonight. In 2020, there were over 50 million, 53, 57 million cases of Alzheimer's worldwide. That's a chunk of folk. It was first described in 1906 by Dr. Alois Alzheimer. He was a German physician. He had a patient with dementia, and he studied her brain after she died. And he found these clumps of goo, amyloid, on the surface of the brain. And then he saw these tangles in the dendrites, or the arms of the neuron that reach out to talk to other neurons. And so it became Alzheimer's disease since he first described the pathological findings at a post-mortem study. Let's just mention amyloid for a minute. Amyloid is normal, okay? You have amyloid in your brain. Amyloid is an inflammatory response to the threat of an infection, inflammation from poor lifestyle habits, or maybe metabolic stress, okay? Some of our metabolic states are so inflammatory that the brain will try to protect itself and make amyloid, which is basically snot to cover the wound, okay? Kind of like a scab. Usually that's removed when the threat goes away. But in some of us, it accumulates over years. And we're talking about years. Okay? This takes decades to develop. And then the other thing he saw were the tau tangles, T-A-U, tau tangles. These occur in the dendrites. Here's the nerve cell, here's the dendrites. And I'm talking to this nerve cell over there, and that one over there, and he's talking over there and over there. We have hundreds of billions of nerve cells in our brains. And they make hundreds of trillions of connections, okay? Well, with amyloid deposition on top of the brain, it causes some of the tau particles to fall off of this fibril that carries the nerve impulses, the neurotransmitters, and the electrical signals down here. And when that happens, these wires corrode, they tangle, and they can't signal. And when that happens, the nerve eventually dies. But that's what Dr. Alzheimer first described. And for many, many, many years, diagnosis could only be made post-mortem because there are many types of dementia. And you can't always tell, oh, this looks like Lewy body because there's dementia with Parkinson-type symptoms. But it looks like it's a little bit of dementia, but he had a stroke also. So nobody has pure Alzheimer's. There's always a little mix going on. But we can all make the diagnosis post-mortem. Now we have better testing. We have screening tests that your doctor will give you at your checkup, the MOCA, the Montreal Cognitive Assessment. And if you're over 65, you've been set down and had this test. It's a score of 30. I only made 29 out of 30 my first time. My last one was 26. So it changes depending on the day. I have good days, I have bad days. This feels like a better day. But your doctor will screen you to see if, there's some terms here about your cognition because you couldn't name the giraffe, or you couldn't remember the 3 words I gave you 3 minutes ago, or you couldn't draw the clock exactly. You couldn't show me what time it was on the clock. So some of you have had this test. If not, you'll have it soon. There are other things we can do. Once we have some concerns about cognition, that's a screening test. It's not diagnostic. But then you can have more testing. An in-depth neuropsychological test, an in-depth neurocognitive test to see where you are. What's your baseline? How much cognition have you lost? How much can we preserve? So we have excellent diagnostic things now. We have had for some time biomarkers. We can test in your spinal fluid, is there amyloid protein in there? Is there tau protein in there? I did not for the spinal thing. But we now have blood biomarkers. Your doctor can check your blood for the same type test, amyloid markers and tau markers, to see if there's active amyloid deposition and possibly a threat to your cognitive reserve. We also have extremely good imaging, MRIs, PET scans, that can really nail down the diagnosis within about 99% certainty, which we were never able to do before. So if you have concerns, get screened, see where you are, and see if you have a diagnosis or not. This slide is interesting. It shows you breast cancer, prostate cancer, heart disease, stroke, HIV, AIDS, and Alzheimer's disease. And this shows the percentage changes in mortality. Some of these are going down because we can treat breast cancer. We can treat prostate cancer. We can treat heart disease and stroke. We have excellent medications for HIV. And let's hope that we continue to make those available throughout the world as we have. Alzheimer's disease, not so much. But we'll talk about available treatments and other things that we can do. I'm going to take a few minutes to tell you my story. This started in June of 2024. I went to see my wonderful PCP, and I told him that I was waking up at 2 and 4 in the morning. I'm not going to tell you why I got up, but I was waking up at 2 and 4 in the morning. I had a headache. And I thought it was probably just my pillow and some neck spasm, you know? But I'm a pediatrician. And if a mom tells me, or if a toddler or a school-age child tells me they're having headaches in the wee hours of the morning from 2 to 4, I'm worried about increased intracranial pressure. I'm worried about a brain tumor or something wrong with the fluid circulation of the brain. And he could hear the anxiety I had in my voice, and he ordered an MRI. I got the report subsequent to that. It showed some cerebral atrophy. And we'll talk about that in a little bit. This led to a visit with a local neurologist, and she did my MOCA test. I scored 29. Other people aced it. I wasn't that fortunate. And she did an APOE4 genetic test. That's a genetic test we can do to see if you have increased risk for Alzheimer's, increased risk of losing your cognitive ability. They also did volumetrics on my MRI scan to see how my brain compared in size to age-controlled standards, my age, how I compared with them. And the last thing I had done was in November at the Messina Cancer Center. I had a PET scan. So a PET scan is a CT scan, but we inject a radio-labeled thing. And they do it for cancer because cancers grow faster than normal tissue. So when they inject this at the Messina Center, your cancer will light up. They can see where you have cancer. They do the same thing with Alzheimer's. They inject the glucose, this radioactive label, and then see how well your brain uses the glucose. And from that, they can deduce how much amyloid is there. I had that in November. That pretty much cinched down the diagnosis of Alzheimer's. In January, we had a family meeting. My son and daughter-in-law are here. It was a great weekend. I can't help but smile about it because there was a lot of laughter, because that's how I communicate. And there were a few tears. But we wanted them to be the first to know. And then we tried to contact as many close friends as we could. And then I spilled my guts in the community. But there's that. In February, I got an appointment at the Duke Memory Clinic. My first appointment was not until May. Well, that wasn't going to work for me because I could not live with what was a secret from June. We pretty much knew what the problem was from June. And to carry a secret is difficult. I was able to talk to a good friend of mine, Bill Allen, who's a geneticist, who walked the Camino with me, or actually he walked the Camino with a person with muscular dystrophy and Alzheimer's. He didn't know it at the time. And so I had an outlet for that. My wife had to hold this secret for longer than I did. And then after we told our children, she told her close friends as well. I went to Duke to get a second opinion, pretty much knew what it was, and then to see what treatment options might be available. Nothing really was available for me, but I have hope and some choices that I want to share with you. So let's talk about the brain. The frontal lobe is right up here, and it helps us with executive function, and that's making decisions, judgment, and you can tell mine's effective because why did I agree to do this? It helps us with problem solving and then control of purposeful behaviors, our consciousness and our emotions. The temporal lobe is here, behind your ear, the green one. It is involved with processing auditory information and helping us to process and organize speech and vision. It also houses the hippocampus. It's inside that lobe. It looks like a little seahorse. And remember, this is one side of the brain, there's a whole other side on the other side. Both different sides of the brain do different things, but they work together. And the dendrites communicate from side to side, front to back, and up and down. It's just amazing what the brain can do. If your hippocampus is damaged, that's where we have working memory. That's where we organize our memories and put them in storage. And if it's damaged, you lose your ability to have memory, and you also have some disorientation. And we'll talk about that in a little bit. The parietal lobe up here is processes sensory information. Y'all are over there, and I'm touching this, and the table's behind me, so I know where I am. and it helps you with navigation, get from one place to another. Okay? And there are other loads that we're not going to dwell on today, but they can also be affected by amyloid and tau protein and Alzheimer's. Let me tell you where I am with some of my symptoms. I was coming back from Asheville. I can't remember why I was over there, but that's a whole other discussion. And I checked out at the counter. And the guy said, man, that's a lot of vegetables. He was new, young, he was late. I said, yeah, I like vegetables. And so he checked out my kale. And he checked out my parsley. And he checked out my green onions. And then he held up this bag and said, sir, I don't know how to check you out. And he held it up in front of me. And he said, what is this? And I went completely blind. I had just blind. Just gotten off the show. I was completely blind. And I looked at him, and I looked at the bag. I looked back at him, and nothing. And his buddy came over from another register and said, that's bok choy. I said, yep, I bought me some bok choy. So I will blank on a word. It just won't be there. Sometimes it will come to me, and we all have seen moments. That's normal. But sometimes I'm just a blank slate, and I can't recall it. I'm going to take these home tonight and make a salad. So that's part of my world. Another part of my world is I was driving along, going to meet Kevin, Sarah's husband, at Brevard Academy. We had a fundraiser for Spark Point. I'm the president of the board. I love this organization. They do so much for the community, connecting groups with each other, collaborating, and responding to emergencies such as the mental health crisis that we've all experienced in the last few weeks. And they collaborate with TC Strong, Voice of the Students, and the Care Coalition. It's just amazing what our team and board do. But I digress. I'm driving along, and ironically, I'm meeting Kevin at Brevard Academy. And I'm passing Brevard College and going up the hill. I'm not Brevard College. Some of you live there. And I was driving up the hill, and I went, whoa, where's Brevard Academy? Oh, man. I know where Davidson River is. Over here, I'll turn right. And I was blanking. And that's the hippocampus navigating in my private lobe. I was a little disoriented and a little lost. And then I remember, I played bagpipes at the cemetery, and Brevard Academy was right next to it. So I was able to find Brevard Academy. But I had moments like that where I'm a little disoriented and a little lost. My wife made me put "Find Me" on my phone. So that's my world now. Another thing, I have never been good at names. You can ask the staff that worked with me for years on my family. I've just never been good at names. It's now hopeless. So if we're talking after this, or if you see me at Ingles, and if you see kind of a blank stare, just say your name. Because I know you, I know your face, and I know our relationship, but I can't call your name. All right. So, the brain is amazing. We can't build a computer to do what our brain does without using extraordinary amounts of energy and taking up acres of space. Our brain is under threat. Okay? We live in an environment with infections that threaten. COVID, long COVID, brain fog. It affects our brain. It threatens our brain. Heavy metals in our water, in our soil, in our paints threaten our brain. Glyphosate. We spray our crops with things that aren't even allowed in Europe, and then we consume this food, and that threatens our brain. One of the biggest threats to our brain is ultra-processed food. It's not even food. It's refined food substances that are then combined in certain ratios of sugar, fat, and protein, and then dusted with chemicals to give you a delicious, bliss point taste. A Dorito, for heaven's sake. There's nothing more delicious than that first Dorito. It's just not food. And unfortunately, we're consuming way too much of that. And it doesn't lead to healthy metabolism. And that threatens our brain. And then there's plastics. Now, I'm 73 years old, so I remember The Graduate. Does anybody else here remember the movie The Graduate with Dustin Hoffman? Yeah. The scene at the cocktail party where it says, plastics, my young man, plastics, or something to that effect. So one study I read said that the average person in the United States consumes 1, 2, 3 bags of plastic every year. Another study said 4, 5, 6, 7, 8, 9, 10, 11, 12 bags of plastic every year that we consume in the foods we eat. And these are micro-sized plastics. The ocean is plasticized. They do studies on placentas, and they're not placentas anymore, they're frisbees. They're so full of plastic. And this is what we're eating. You chew a piece of gum, you get 100 particles of microplastic. Okay? Our environment is threatening our brain. And there are things we can do to help ameliorate that. One other thing I was going to mention. They've done studies on brains after death, and they found plastic in our brains. 7 grams of plastic. That's 7 grams of plastic. I'll get it later. This is 7 grams of plastic. That's in my brain. Okay? This is the environment we live in. Our brain is being attacked. We have to learn how to take care of it. And that's what the rest of the talk is going to be about. So, I mentioned I had an MRI. What's an MRI? It's amazing. I've been to 3 different lectures on how an MRI was invented and how it works. And I've just been enthralled. How did they think of this? How did they build it? How do they do this? And then I leave the lecture, and 10 minutes later I go, what did he say? Basically, it's a huge magnet. And they put you inside this magnet. It's very loud, they're getting better. And when they do your brain, you get put in this little vice that holds your head still so you don't have any movement artifact. And that magnet aligns the hydrogen atoms in your body. They all line up like a bunch of little army soldiers. And then they expose them to radio waves. And then based on how the protons in those atoms respond to the radio waves, this big old computer over here can use not 50 shades of gray, but 250 shades of gray to make images of the brain. And there's no radiation. So it's much safer than a CT scan. It's an amazing diagnostic tool. So I mentioned that I got a report. My report said no acute infarct. I hadn't had a stroke that my doctor ordered the MRI for because I was having a headache. No hemorrhage, that's good. And no intracranial mass effect, so no tumor that they could see. That was reassuring. The rest of the report said disproportional marked cortical thinning, parenchymal volume loss in the bilateral parietal lobes, and to a lesser extent degree the frontotemporal opercular regions. What did he say? So I wanted to see the image. So here I am at the hospital. I couldn't play the DVD at home on my computer or any of my DVD players. So I'm on my knees at the counter in the radiology department, and the women knew this, so they let me do this. I put the DVD in the computer and I looked at the monitor. And this is a normal brain over here. You see fills the cranium, big healthy gyri on the surface of the brain. There's some frontal lobe, parietal, occipital lobes. And then you see the lateral view here. And while I'm doing this, I'm recording only images I have on my phone. And I'm trying to scroll the computer because the MRI has several different studies. And then I look at mine and go, Shazam. Whoa, dang. I wasn't expecting this. And I wasn't upset. I was a little befuddled, but I was amazed. It was not what I was expecting. So here I have marked loss of my frontal lobes. This is called atrophy. it's shrunk, it's pulled back from the cranium. And even here in the orbicular region that was mentioned, this is the ventral, that's just fluid. And then this is what they call disproportionate atrophy in the parietal lobe. I beg to differ. This is the whole. But that's radiologists. They take the head. So I left that day, and I wasn't upset, and I wasn't crying. I was just, I need to know more about this. I need to understand what's happening to me. So I read everything I could get my hands on. If I need to learn something in a hurry, what do? You go to YouTube. Now, there's some terrible stuff on YouTube, and there's some amazing stuff on YouTube. And in your handout, you have these books that you can refer to, and also some YouTube I'm going to recommend to you. And you don't have to do them all, but just play around with it and see if something sparks your interest, and then you can learn more about it for your parents, for your children, for yourself. I joined Heartfelt Pediatrics in 1982, one of the best decisions I ever made. That practice is as old as I am. It was founded in 1952, I'll say you. Wonderful staff, wonderful doctors. You don't go into pediatrics to make money, you go in there to serve families and to serve children. And I'm so proud of the work they do. And I promised them at every annual long-range planning for 40 years, or 39 years, that I would give them 3 to 5 years notice before I retired. Because when a senior physician retires and has a panel of 2,000 to 3,000 patients, that's hard to transfer. It's hard for the practice to take over. Plus you're recruiting a new doctor, and they have to get situated and oriented and build their own panel. And I promised them, year after year after year, I'd give them 3 to 5 years notice. I gave them 3 months. In January of 2022, I told them that I was retiring. Actually, I retired April Fool's Day 2022. That's something I wanted to do. Because I realized I was so tired, I was so weak, and I thought it was this muscular dystrophy thing I had. And I thought it was because I was 70, and I'm old and fat, and I had high blood pressure and dyslipidemia, and I was pre-diabetic. I just thought, physically, I can't do this anymore. And I wanted to get out before I lost a mental state. And my staff, I don't know if anybody's here, but we had a rule in the office. If Dr. Wells makes more than 3 errors in a day, and that might be leaving somebody in the room and skipping over, okay? If you've been in my office, it might have happened to you. Or maybe I forgot to go back to the room after the lab test was done. Or maybe I made some other faux pas. If I made 3 in a day, they would call my wife, Susan, and have her pick me up and take me home. I now know that my body intuitively knew that there was something missing. And I think I retired at the right time. Let's talk a little bit about the stigma of Alzheimer's. Alzheimer's. I want to do a little exercise. You don't have to close your eyes, but just imagine. I'm going to read off 5 diagnoses. And imagine that you have this and you're facing it for the first time, or you're loving it. And then feel what that means to you. And then I want to know which of these 5 give you the most dread or fear. A heart attack. Maybe you're having to have catheterization, a stent, or maybe you need bypass. A stroke. You've shown up and you've had a loss of speech or something else, and you need clot busters and a prolonged rehabilitation period. You're in intensive care unit with COVID or flu or pneumonia like the Pope, and you're needing assistance with breathing. You have cancer. You may be facing surgery, chemotherapy, or radiation. Or you have Alzheimer's disease. Which one of those in you creates the most fear of dread? In the study, they found that 13% it was a heart attack, and 15% it was stroke. 21% dreaded cancer the most, and then 32% it was Alzheimer's. You can ask me, why did I wait so long to I didn't want my children to know until I was certain, okay? And it took about 9 months to be certain about the diagnosis, to complete the diagnostic workup, although we pretty much knew all along. And after they knew, we were ready to let the news out. But I didn't want people to see me at Ingalls and see Alzheimer's. I still wanted to be Ora. I didn't want to be diminished or put up on a shelf. And so I was really worried about the diagnosis being the mass you see and not me. The stigma also results in delays in seeking care. Who would want to know they have Alzheimer's? I'm okay. I'm just having a senior. Everybody forgets a word. Everybody gets lost. And that's normal in a lot of us seniors. And then sometimes it's not. So there's a delay in seeking diagnosis. It's denial. It's just a thing. Or you may see your provider. I saw one neurologist in the middle of this workup who was following me for another problem, muscular dystrophy, and he kind of patted me on the knee and said, don't worry, because he didn't see any loss of cognitive function yet. And that's a problem with providers. They don't want to make the diagnosis. They don't want to be the doctor you remember gave you the diagnosis of Alzheimer's. They would go refer you to a specialist and let them make the diagnosis. The other thing is the stigma can often lead to a missed opportunity for early intervention, possibly early treatment. The other stigma is, even today with new and exciting treatments, it's still a pretty hopeless problem. We're learning more every day. There are new treatments in the pipeline. But I'm going to talk about things we can do to keep from needing treatment. How do we overcome stigmatization? We have to educate ourselves. What is Alzheimer's? What are the risks for Alzheimer's? What can I do to protect myself from Alzheimer's? We have to be aware of it in our loved ones, our parents, our children, ourselves. And then we have to be willing to touch it, to go to an assisted living center where our friends are in, to touch it, and to be with it, and to visit with it, and to connect with it, and to own it. It's part of all of our lives. After attending an NIH conference, I think they're still on NIH, I'm not sure. This was on AIDS. It was put on by Dr. Fauci, a young Dr. Fauci. I'm not even sure he was shaving back then. And it was about HIV. This was a national world conference. And I was on the faculty at Charlotte Memorial Hospital as an associate pediatric professor. And so they sent the young guy out there to go to the conference. I learned so much. And when I came back, I could not help but speak about it. So any opportunity I have, I would speak about HIV. What are the risks for contracting it? What can you do to protect yourself from it? And everything else about it. And the terrible thing about it is it was such a stigmatized disease. It was the others. It was men who have sex with men. Oh, it was Haitians. It was drug addicts. It's the others. And the turning point, in my mind's eye, for Alzheimer's, there you go, for HIV, came when Rob Hudson was diagnosed and died. We all knew Rob Hudson. We all loved his movies. And then we had to own it. This is happening to people we love. This can happen to us. And so some of the stigmatization went away. And it also happened as we began to have effective treatment. So we need to bring Alzheimer's out of the closet and into the light. And that's what Denise Young is doing. She's with the Alzheimer's Association desk in the back. Please visit her when you leave and get information for yourself and your parents and your children and become involved. There is new treatment, exciting treatment. It's not the best treatment. But there's other treatments in the pipeline coming along. But my hope is that we won't need treatment because there are ways to avoid or delay or protect your cognitive reserve even if you have the risk of Alzheimer's. I'm going to take you on a little trip. We're going to call Ora up. He's 35 years old. Oh, wait, we didn't have cell phones. Anyway, I'm going to go see Ora. Okay, he's 35 years old. Hey, what's happening? You need to know something, Ora. This is back to the future. You're 73 years old and you have Alzheimer's with minimal cognitive impairment and you're in stage 2 out of 3. I need to talk to you about this. There's some things you can't change. like your genetics, your family history, or your gender. Women are 2/3 of Alzheimer's patients are women. And 2/3 of the caretakers are women. This is a woman's issue. So as a woman, you need to be informed to know what your parents are at risk for, what you're at risk for, what your children are at risk for. There's some concern about menopause. Estrogen protects your brain from Alzheimer's. And then when you have menopause and more estrogen, it puts you at greater risk for developing dementia. 25% of us with Alzheimer's have a family history. My mother was diagnosed at 70. My brother took such good care of her. She died when she was 80. She was pretty much a happy Alzheimer's patient, and I hope that's what I am. I don't want to be a mean, demented patient. And there's this funny thing, the APOE4 gene I talked about. What is that all about? Well, let me tell you what that's about. So on your 19th chromosome, we have a bunch of them. I think we have 23. So on that 19th chromosome, there's a gene, and you get one from your mommy and one from your daddy. And there are 3 different types of that gene. There's 2, 3, and 4. Type 2 is only in 7% of the generate population. It actually protects you from Alzheimer's. It's just 7%. And it's kind of like what this gene does. It tells the apolipoprotein. That's what the gene has the body make. It's an apolipoprotein. It's an Uber. It's an Uber driver. And this little Uber takes cholesterol to all parts of your body, and then lets us do its thing. We need cholesterol. Our brain is mostly fat anyway. We need cholesterol everywhere. But then after it's done, it cleans up its mess. Okay? And the 2 gene does a great job of this. It's kind of like my brand new Ford Maverick hybrid all-wheel drive. It's out of the parking lot. I'd love to show you today after the talk. But it gets 38 miles per gallon. It's a green car. It gets the cholesterol there, and it takes its mess away. The type 3 gene is in 75% of us. Okay? You might be a 2-3 or 2-2 or 2-3. So the 3 doesn't care. It doesn't protect you or put you at risk for Alzheimer's. It's like my old Tacoma that I traded in for the Maverick, 2007. I bought that car when I was 55 years old and a young man. This is hard to talk about. But I traded it in, and when I left the dealership, it was like a dog standing at the side of the road. It only got 14 miles to the gallon. I can haul brush out the wazoo to the landfill. It's a good solid truck. So it could carry cholesterol where it needed to go, and it could haul a bunch of garbage away. It did the job. But it doesn't put you at risk or protect you. And then there's APOE4. This gene used to protect us from parasites. There's no gene in the human population that exists unless it does something for you. Like sickle cell anemia. If you have one copy, there are 2 copies. If you have 2 copies, you're very sick. And when I was a young doctor, these children did not live long, and they were in terrible pain. We now have effective treatment where these people are reaching adulthood. But if you only have one gene, you're protected from malaria. That's why it persists in the human gene population. You're protected from malaria. 2, not good news. Same thing for cystic fibrosis. 2 copies, terribly sick children. But we have better treatment. When I was a young doctor, children didn't live past 8 or 10. We now have patients of mine. It's just so wonderful to see them grow up as adults, find work, make families. So 1 gene protects you from cholera. 2 genes, not so good. And the same thing that's true for APOE4. If you have 1 gene, I'm a 3-4. So when I had my APO4 test at my neurologist, it came back, I got a 3 from my mom and dad, and I got a 4 from my mom and dad. I suspect I got the 4 from my mom. Only Jesus knows. The general risk for Alzheimer's in this group is 9%, okay? If you live long enough, you're going to get Alzheimer's. And I brag to people that I did live long enough to get it, so there's something there. If you have 1 copy of the 4, it doubles or triples your risk for Alzheimer's. So it goes from 9 to, let's say, 30%. 25% of us have type 4 APOE. 2% of the population have both copies, mom and dad. And that increases their risk by 10 to 12 times, 80 to 90%. But let's listen to that. That's risk. That's not diagnosis. That doesn't mean you're going to have Alzheimer's. People with 2-2 get Alzheimer's. People with 4-4 don't. There's something called the Nigerian paradox, where old people in Nigeria have 4-4 copies and less Alzheimer's than we have. How could that be? It is a little different genetic subset, but they also don't get colon cancer at the rate we do. Well, how can that be? They eat fruits and vegetables. They can't afford much meat. Meat is a condiment to them. And they have healthy lifestyles. They walk, they talk, they move. So the genetic risk factor does not tell you you're going to have Alzheimer's. It tells you what your risk is so you can be more aware and take proper steps to avoid maybe developing Alzheimer's or at least putting it off for a while. So remember, don't be afraid to have your test done. It doesn't tell you that you're going to have Alzheimer's. And people with 4-4 don't get it. So that's a little Uber driver with the APOE4 gene. I'm going to talk to you also about your diet. When I was in my 30s and 40s, I was on the standard American diet. The acronym for that is SAD. So, man, I missed the Whopper shop. I had Whoppers as a kid. And if I was going to drive to Hempstead to do a night clinic or a weekend clinic, I'd stop and get a Whopper and eat it on the way there. Or that's not the best plan. And then alcohol misuse. I've never been a heavy drinker because I'm a cheap date. If I have a full beer, I'm asleep. I won't tell you what happened with that too. And then I tried to smoke in college so I'd be cool, but it didn't take. So I didn't abuse my body here. And then diabetes. I ended up in my 50s and 60s with pre-diabetes. 15% of pre-diabetics become diabetic over 2 years. So I'm pretty sure I'll have type 2 diabetes eventually. My blood sugar this morning was 145 because I was a little stressed about doing this talk. And that was my cortisol spike in the early 20 hours. So be patient with it. 50 to 80% of Alzheimer's patients have type 2 diabetes. Type 2 diabetes doubles your risk of Alzheimer's. It's the same as this gene. Okay? So genetics doesn't have any more influence over you getting Alzheimer's than if you have diabetes. 38% of us in the United States are pre-diabetic. And as I mentioned, 15% convert to full diabetes type 2 every 2 years. 12% of us here have diabetes. 95% of type 2. Or, let's talk about your weight. When I was in elementary school, I wore Sears Husky pants. You know what I'm talking about. I've always been pleasantly plump. And I always liked telling mothers in my office when their son or even daughter was involved in wrestling or football that I played those sports and I loved them. And I told them, asked them what they thought my nickname was on the team, like Killer Viking or the Mad Scotsman. What do you think my nickname was? And they would guess, and I'd say, my nickname was Tubby. So I've always been challenged. In my middle life, I was 250 pounds. This is what I carried around my whole midlife. When I was at Lowe's, I was going to get 50 pounds of manure, but that was too close to the truth. My blood pressure has always been high. It's controlled now because I've lost 50 pounds and I'm on medicine for it. It used to be 140 over 90. My dyslipidemia, my cholesterol was the same as my weight, 250. My triglycerides were always over 400, based on my obesity, my sad diet, and just not living a healthy lifestyle. And then we can go to neuronal damage. I played football, wrestle, and rugby. Those are three of the most concussion-prone sports there are. I've had 3 concussions, I know it. And so part of that hole you saw might have been sports-related. Only Jesus knows for sure. And then vascular insults. In 2017, I had a cardiac catheterization. I was having some extra heartbeats, a little bit of squeezing, and it turned out it's reflux and esophagitis. But I had a heart catheterization done at the Mission Tower, and they put a little wire in my wrist, and they looked at my coronary arteries, and I came out, and they said, Dr. Wells, you're fine. You have 20, 30, and 50% obstruction. You don't get a stent unless you're 75% obstructed. You don't get bypass unless you're 95% obstructed. They said, you're fine. And they said, for somebody as fat as you are, with your blood pressure and lipids, you're going to be okay. And so I enrolled in the CHIP program, the Comprehensive Health Improvement Program. And one of my heroes, Brian Aslow, was running on a mission. I had to do it remotely because I was going to Vietnam with my siblings. But I completed that course, and it's a lifestyle choice. It's actually an Adventist program, okay? Whole food, whole plants, move your body, hang with your friends, have a spiritual life, all the great things that the Adventists do. And it's life-changing. It's a robust cardiac rehabilitation program. It's also good for your brain. What I didn't realize is the vessels in my heart are just like the ones in my brain. I was worried about my heart, and I wasn't paying any attention to my brain. But it was undergoing the same stress as my brain was. Okay, so basically, the midlife war is a mess. I love my midlife. My family raised, my wife raised my kids. I had great practice. I was saving lives with Alzheimer's disease. I wouldn't change a thing, except if I knew then what I know now about my diet and what I could do about these problems, I might not be here today doing this talk. So those are the risk factors across the lifetime. There are protective factors. Education. Early education and the level of educational attainment can protect you from cognitive loss. If you build a big enough cognitive reserve and make enough connections with the attainment of your education, not years spent, but how the level of attainment you reach. And then if you have continuing cognitive stimulation with your job or your hobby or your work, those connections will be preserved. And it protects you. Now, your cognitive reserve is kind of like a 401k, and as you saw from my MRI, I've already spent half of that capital, and I'm living on the interest. But I'm a lifelong learner. Last year, I learned about dyslexia, because I have a grandson with dyslexia. Learned everything I could. And I became an Augustine Literacy Project tutor. And so this year I've learned about Alzheimer's. So keep learning, keep making connections in your brain. So even though half of my 401k is gone, I'm still making very small deposits. And hoping that I can stretch out my cognitive reserve for a while longer. And then, cognitive, physical activity. Any activity is better than none. There are guidelines that say we need 150 minutes a week of moderate aerobic treadmill. I love my deep swimming class. Kay's out there somewhere. And then we need strength training. We need to keep our muscles. There's something called sarcopenia, where old people leave their muscles. I played bagpipes yesterday at a VA function in Mills River, and my kilt in the back hangs down 3 inches further than the front. I got no butt. Now, I'm going to get one of those, what's that roll that women wore in the Victorian times? I just digress. Anyway, I digress. So we need our muscles. We need our muscles in old age so we don't fall, so we can lift things. So continue to be active. Get aerobic exercise. Do strength training 2 or 3 times a week. Move your body. The brain, God designed us to walk and talk. Be engaged. And the same thing goes with social activity. Be in a group, book club, card playing club. Put yourself out there. As an introvert, that's a big effort for me. Brain reserve is just the size of the brain And so most of us have brain reserve. Not so much me. My brain is 55th percentile, age mass control. That's not bad. 5th percentile would be really bad. It's not great. My hippocampus is 35th percentile for age mass control. I think that's why I have blocks with words and your name, and why sometimes I wonder, I know where I want to go, but I'm not sure how to get there. And then, but we can protect this. All right, let's move on. Yeah, we'll probably be here till 3 or 4. Oh, by the way, your handout is so good. If you have to get up and leave, everything's in there, okay? My team, Sarah and Charlotte, did such a good job. Everything's on the handout. This is a picture of the American diet designed for disease. 51% of what we eat is refined or processed food. It ain't food. It's in a bag or a box. Some estimates say that our children are eating 67 to 80% processed food, depending on their age and whether they get school breakfast and lunch. It's not food. It's not good fuel for the brain. And they're going to pay a metabolic price in the future. And then 42% is dairy and animal. There's not necessarily anything wrong with this, but this is disproportionate. This meat should be a condiment. It should add taste. That's what the rest of the world does. They put a little bit of meat in the soup to give it a taste. They don't eat 20 ounces 3 times a day. We were never meant to do that. And it's putting a terrible stress on our ecology in terms of deforestation of water. And then 7% fruits and veggies. Well, that's why the guy that checked me out in England was so surprised. I had a cart full of vegetables. He doesn't see people checking out like that. But that's what we need. This should be turned upside down and backwards. We should be plant slant based. You may remember the blue zones. Brevard is a blue zone certified community until Jesus comes. And they stress that 75 to 85% of your plate should be plant based. And then knock yourself out with dairy and meat products. And occasional treat. But this is upside down and backwards. We are metabolically sick. So I like to think of Alzheimer's disease as type 3 diabetes. That's not the best model, but it works for me. Metabolic syndrome used to be called insulin resistance syndrome. Okay? 30 to 50% of us have metabolic syndrome. What does that mean? We have high blood pressure, high cholesterol, get a little bit down, obesity, and prediabetes and diabetes. This is wrecking our bodies and our brains. Okay? It causes oxidative stress. So our nerves and blood vessels are rusty. Oxidative stress. Plants can reverse that with polyphenols. If you eat the rainbow, you can get rid of some of that oxidative stress. It causes systemic inflammation. Our organs are running hot. Okay? It's like you're low on oil in your car. Your motor is running hot. It needs more fiber, plants, and hydration. And then we're not going to talk about mitochondria today, but there's those little bitty organelles. It's fascinating to look at the history. We used to have eukaryotic cells. They were only single cells for a long, long time when God was making things. And then this little rickettsia-type bacteria over here kind of made a house inside that cell. And they traded off. The cell gave the mitochondria nutrients, and the mitochondria gave the cell energy. And that's when life exploded, and God continued his work in creation. We have 10 pounds of mitochondria in our body. But they can't charge themselves anymore. They can't charge in this hostile metabolic environment. We need to change how we live. It's as if we are burning with this diet. Well, let's just talk about that for a minute. So in 1915, the average American ate 17.5 pounds of sugar. Whew, that's a lot of sugar. But wait. I borrowed this from, what's the place at the top of the hill? George Washington. 25, 50, 60, 70, 80, 90, 110, 126 pounds of sugar is what we consume every year. This is sucrose. If you read your food label and the third ingredient is sugar, put that bag or box back. Because it either has too much sucrose, glucose, or high fructose corn syrup in it. This is what we're eating. This is what we're feeding our children. This is like burning wood chips in your fireplace. You're going to get a chimney fire. Our organs are on fire. Our bodies are consumed by inflammation. We can't do this. My brother was going to come down, but because of the smoke, he decided not to drive down here from Kentucky. I was going to give him this because he's a beekeeper. Now I don't know what to do with it. We need to be metabolically flexible. The brain does prefer glucose, but not this much. It's on fire. Okay? We need to be metabolically flexible. We need to give the brain glucose, but it can also use ketones, fat. And our body makes ketones when we fast, because we can mobilize our fat and give the body fat, give the brain fat to burn, and it loves fat. You can have more mental clarity. We used to treat pediatric surgeons with ketogenic diets because of the calming effect it has on the brain and lucidity it gives us. So we need to burn some glucose and some fats. So we can fast at night. You may get into ketosis if you don't get up and eat a snack. If you have a 12-hour fast, or a 14-hour fast, or a 16-hour fast. We need to give the body and the brain metabolic flexibility to use different fuel. We can't keep giving it wood chips. We're going to have a chimney fire. We can burn pine log with better choices as far as complex carbohydrates, not simple carbohydrates, and maybe better protein choices, but plants, the vegetables, the fruits, the nuts, the seeds. But all those things feed the microbiome in our gut. I love to talk about the gut. I didn't bring a model of the gut because it's kind of smelly. But it runs from here to yonder. And if I laid it out, it would cover this much of the stage. It's the biggest organ in our body. And it does more than digest food and make us burp and fart. It's the first line of our immune system. It makes its own serotonin. It communicates with the brain 24/7. We have more bacteria, viruses, and fungi in our gut than we have cells in the human body. If you have a sterile gut, you die. We need to feed that microbiome. We need to feed it. And they eat fiber. So eat your fruits and your vegetables and your nuts and your seeds. And whatever else I'm leaving out, Sarah. Okay. So where are we now? We have a choice. There's a fork in the road. And in my midlife, this is the fork I choose. Man, I miss it. Shoot. Yeah, look at that. Oh, that's what. Oh, the milkshake and fries. Yes, ma'am. Bring it on. And these are okay, but not 3 times a day. Okay? The better path to take is fiber. This stuff is delicious, and you can change your taste buds if you give yourself a week or 2. Now, what is this? These are from Mexico and Chile. They have such a problem with obesity, they're putting warning labels on their processed food. We did that with cigarettes, remember? But it didn't change marketing. And so far, this has not changed purchasing, but they're doing it. What changed the purchasing? We had public policies. You couldn't smoke in public. So policies can correct this. Maybe we don't serve this to our kids in school. And then they sued the tobacco people. I don't like lawsuits. But we need to do something because the lobbyists who are pushing this stuff on us are immune to what they're doing to our health. They can't continue to do this. We need to make better choices. We need to inform ourselves. And we need to make sure that these are treats and not something that are. I love my grandkids. But they eat 16 hours a day, and a lot of it comes out of boxes and bags. And we can change that. We can help them metabolism. All right. Oh, and from 1970 to 2000, oh my gosh, a lot of time. Okay, we'll speed this up. From 1970 to 2010, fast food restaurants doubled. And that was 14 years ago. One day from my office over by the hospital, I counted the fast food places to my home past the high school, and there were over 20. When I moved here, we had Berries. Who remembers Berries? We didn't even have a McDonald's, we had a Shoney's. And now they're everywhere. And there's nothing wrong with fast food, but not 3 times a day. Not, it's just, we need to improve our choices. Okay, let's move along. This is just a lifestyle food pyramid, and it shows what we do in medicine. And we depend on surgery. We depend on prescriptions. We want that silver bullet to fix our problem. But some of these problems can be avoided if we have the base of lifestyle, changing what we choose to eat, changing how we move our body, changing how we sleep. When we sleep, the brain takes out the garbage, changing who we hang with, and changing all our other social parameters. It's easier to prevent a disease than to treat it. And I'm just going to say quickly, this is on your handout. There's a company called Verda. I joined them in 2023. I'm not a member now. It's a virtual clinic for people with type 2 diabetes. It's also now a virtual clinic for weight loss, because the miracle drug they came out with, the GLP-1s, your Ozempic and Wegovy, have a profound effect on type 2 diabetes. It lowers the blood sugar. It makes you feel full so you don't eat as much, and they're having remarkable results. It's dangerous because half of the weight you lose is muscle. So if anybody's on a GLP diet, they need to work out strength exercises 3 times a week to preserve their muscle. Because when they stop it, all that weight comes back. And it's not muscle, it's all fat. It's hard in midlife and older seniors like me to regain muscle once you lose it. So we have great treatments out there, but they're not always safe. But why I wanted to mention this is, there's I just listened to a Spotify thing talking about the $1 trillion shot. Ozempic, Wegovy, they're not combination drugs. The $1 trillion shot, because this is $1,000 a month to be on. It was designed for diabetics. A large proportion of it is now for weight loss. It's being used off-label. It works. Why do you use it? 70% of people stop it because it gives you nausea and vomiting because your stomach never empties. You're full all the time. That's how it works. It does lower your blood sugar. You do lose weight. And someone has to stop it for the money. It's not the answer. But what Verda does, it takes those people, and if they get into their program, and they have medical supervision, they have a coach, they have a nutritional prescription, and you can modify that according to your choices. Ongoing biomarkers, you get weighed every morning, it goes back to Verda. You check your blood sugar, your ketones, it goes back to Verda. And so you have an accountability, a routine. That's what you need when you're doing lifestyle changes. They can reverse type 2 diabetes 60 to 80% times. They de-prescribe. People come off the GLP-1s. They come off the metformin. They lose 100 pounds. They don't have type 2 diabetes anymore. The only reason I mention this is these resources are available. It costs money. It cost me $250 a year. Now it's $200 a year. But industry is flocking to Verda because they're going bankrupt providing benefits to their employees with GLP-1s, Ozempic and Wegovy, and all those other things. So AutoZone, U-Haul, GE, Blue Cross Blue Shield are asking Verda to take care of their patients because they can de-prescribe, they can reverse their type 2 diabetes, and they can restore their health. So there are ways to do this. And this same treatment would be the best thing you could do if you have Alzheimer's, if you want to protect your cognitive reserve, because you'll have a healthy metabolism and you'll get things lined up. Okay, next slide. I'm sorry I've gone over, but we'll wrap it up. This is your homework. It's in your handout. The Lancet is a very esteemed British medical journal. And every few years, the last one was 2020, and now it's 2024, they identify the risk factors that put you at risk for dementia. They added 2 this year, 2 new risk factors. One of them was air pollution. But this is through the lifetime, early life, midlife, and later life. If you do your homework and look at any of these, and then stack them on top of each other and address them correctly, you can decrease your risk of dementia by 45%, almost half. There are very few things in medicine that have the power to do that. And it's the things we've already talked about. Education for your children, for yourself, continue lifelong learning. Hearing impairment, make sure you hear so you're not isolated or left out. We update our literacy check every couple of years. Get your numbers in line. Depression, that's bi-directional. Depression can put you at risk for dementia, and then, of course, dementia can make you pretty depressed. Traumatic injury. We need to protect our children in their sports. Bicycle helmets, football helmets. Soccer's a great game. Heading, not so much. The professional soccer players are kind of like professional boxers. They all have brain challenges later in life. So protect your brain. In adults, a lot of this is related to motor vehicle accident, falls, oftentimes associated with, hey, what's this? Oh, my beer. So a lot of these are associated with alcohol and increasing our risk for accidents. A new one was uncorrected vision. So make sure your glasses, you have the right prescription. If your cataracts are interfering with your vision, you might have them taken care of. We talk about diabetes. We don't need to talk about smoking. High blood pressure you can manage. Obesity, you can manage, but you have to have a plan. You have to have a routine. You have to make your own food. Don't drive through. And I like to order out. Man, there's some delicious food in these restaurants before. But make sure you have plants on that plate. There's no amount of alcohol that's safe for the brain. Alcohol is a direct neurotoxin. But the big risk is excessive drinking. Social drinking is actually helpful. Remember the blue zones and stuff like that. But it's only because we're spending time with friends, our families, and we're relaxed, we're chatting, we're laughing, we're socializing. That's the benefit to alcohol, not the alcohol itself. And now you'll hear, I heard on NPR, that young people are choosing alcohol-free drinks. I can't remember what they call them. And so they're going out to the bars, and they're socializing, having fun, but they're not having to use alcohol. And then stay engaged socially. The Surgeon General 2 years ago said that loneliness is a threat to the health of this nation. And then air pollution. This can be managed by policy. So this is your homework. Go out, pick the low-hanging fruit, stack your risk factors up, and see if you can decrease your risk of dementia. There are great treatments for Alzheimer's. There are cholinesterase inhibitors. My mother was on some of these. These have been around forever. Okay? They just increase the signal strength in your nerve cells. They're helpful. They don't change Alzheimer's. They don't last too long. If you lose as many nerves as I have, they don't have much of the work. And there are things called glutamate regulators. Glutamate is a big brain signaler. It helps us to regulate that. And then we have brand new drugs. These are disease-modifying drugs. These are the Leqembi, the Kinsula. I can't remember the generic names. These are infusions you get every 2 weeks or every month. And it actually removes amyloid from the brain. And it can remove 60% a year, maybe 80% over 2 years. But remember, that's just the snot of the scale on top of your brain. It doesn't do anything for the tangles in the dendrites. So it's new, it's exciting, it's a breakthrough, it's available, it's good treatment, it ain't great treatment, it's not applicable to me. We have better treatments in the pipeline, but let's not wait to treat it, let's try to prevent it. This is the Ornish study, and this is one of the books over here. Dean Ornish is one of the head cardiac rehab people in the country. We used to have the Ornish program mission, until they were taken over by a more cost-conscious organization. But Dean Ornish is still doing his work. What he does is he prevents, treats, or reverses heart disease with lifestyle changes. He did a study, a randomized controlled study, which means he took a group of people over here, keep doing what you're doing over here. And over here he took another group of people, 50 in the whole group, small, it lasted 20 weeks. And this group had a whole food plant-based diet with minimally processed food. They had aerobic exercise, running, and they had weight training, and they had mindfulness. They had stretching and breathing and meditation and imaging, just to calm that cortisol in the body that shot my blood sugar to 145 a day, to be present, not to be stressed. And they showed 42% of the participants over here had cognitive improvement in just 20 weeks. And not in the control group. Now, the control group was allowed to take part of those benefits after the study was done. The Finnish people did a study called the finger. I won't show you the finger. And it was the Finnish geriatric intervention study. And they took people maybe not as far along as I am. And over a 2-year period, they looked at the same things. And they showed profound differences in cognitive preservation or cognitive loss between the control group that didn't do anything and the experimental group. Denise was telling me recently that the United States has just finished a huge study called the pointer finger study. And those results will be released sometime this year. I'm very excited to see what they've done to show how the choices we make, the risk factors in your homework, can help to prevent or reverse some cognitive loss, or hopefully slow down your portion to dementia. This is the path I've taken. Exercise, I go to the gym at the raffle club and I lift weights for 30 minutes. I go into the sauna for 25 minutes. And this talk is actually a continuation of the sauna class. Is anybody here from the sauna class? We talk about lifestyle and stuff in there all the time. And then I go do water fitness with Kay or Heather for 45 minutes to an hour. And then I just started doing cold plunge for 90 seconds. Which is an eternity. Sleep I'm working on. I don't have good restorative sleep. I'm working on that. You know, they have wearables now, the Ora ring or different rings, and you watch. You can monitor your sleep. Make sure you're getting good restorative sleep, deep sleep, REM sleep. That's when the garbage is taken out of your brain. You can monitor that. You can get data. You can be more aware of what's going on in your body. I love my community. You know, Brevard is just the best place in the world to live. We've talked about, right now I'm on a plant slant diet. Now, at my stage, with half a brain and pre-diabetic, I can't use glucose well, I'm on a mildly ketogenic diet, which means I eat mostly plants and I consume healthy fats like avocado and olives. And I find that my cognition is better, I have less inflammation in my body, and I feel well. And I'm hoping that this will preserve my cognition for a while longer. I think it will. And I think if I hadn't changed my lifestyle in 2017, I might not be doing this. I'm still piping and clogging. And I saw something here. It says, if you want to build cognitive reserve, learn a new language. I listened to German on Netflix, and I'm studying Creole on Duolingo. Learn a musical instrument. Write a book. Learn to dance. Join a chess club or a card group game. Volunteer to teach. Last year, I volunteered as an Augustine Literacy Project tutor. I was very concerned because I knew I had Alzheimer's that I couldn't complete the training. It's 2 weeks, 50 hours, and Wendy Adair is my hero. She has taken a course where we learned the Orton-Gillingham technique to teach children to use phonics to learn how to read. I have a second grader who's a year behind. He's brilliant. He's making progress. I find that so fulfilling. It gives me such purpose to meet with him twice a week. And I encourage you, if that strikes a chord with you, to meet with Wendy after this, because we have 2 tutor orientation meetings coming up. And what we say at our tutoring project is tutor 1 child and change 2 lives. So please visit her out there. I have chosen this path. Bill Breederson is a new trained physician, and he's trying to restore metabolic health for people with cognitive impairment and Alzheimer's. And his book is here. And for my birthday, I got this brand new book. It was released on March 25th, my birthday. I can't wait to finish this talk and start reading this book. There are other people that work with Alzheimer's. The Good Energy book talks about the metabolism. It talks about how to restore your metabolism, what you can do to take care of your body. And then here, Heather Sanderson, love this lady. She's a functional doctor. I'm an allopathic physician. I run a lot of prescriptions and I do a few procedures. We have the strongest medicine in the world. But we're reductionists. We take it down to 1 diagnosis, and we've got 1 prescription for that. And if you have a chronic disease, we'll add another prescription to that. Or we'll give you a surgery over here. We have a lifestyle physicians coming up to our panel in just a moment. And we try to build a foundation to prevent some of these problems, or to restore your health, or to slow down the progression of chronic disease. She's a functional doctor, and we have somebody on our panel who's interested in functional medicine as well. And they take it down to the cellular level. They're looking at what your metabolism is at the cellular level. And it's very exciting to see. Heather has a nursing home in San Diego. She's just opened a new one in Kansas City. Somebody will go into that nursing home, assisted living facility, with a mocha. Remember my score of 29 out of 30? They'll have a mocha of 7. They need help getting dressed. They need help being fed. They may get lost. And after following the protocol that I've been talking about, the diet, exercise, meditation, routine, good sleep, they'll get up to their high teens and they'll go home. And I would love to get a grant in this community and take one of our assisted living facilities and try this, just to see what could be done. Next slide. Now, you've heard all this before. The blue zones, the same conversation. Lifestyle medicine, the same conversation. So let's start to listen and be aware. We don't have to be chronically ill. We can get out of this rat race. We can restore our health and restore our metabolism. It's just a matter of making choices, better choices. I'm not going to tell you what to do, but you can be aware of where you are. Read a book. In your handout, you have YouTubes you can look at, podcasts you can listen to. Just check out one or two and see if it sparks your interest, if it informs you to learn more. Dean Ora says that awareness is the first step in healing. Wonderful man. And hopefully I've sparked some curiosity about your own metabolic health, and you have homework. Okay, so do your assignment and go through your assignment. Denise Young is here with the Alzheimer's Association. She has a table out back. You can get information and learn how to be a volunteer to support the work they're doing, or to find out what's being done in our community already and support them. Visit our support point table and let us know what you're already doing here so we can collaborate. And then scan the barcode. We'll talk about that in a minute. When you leave here today, take action. Do something. Do one thing. Look at the risk factor and address it and see what you can change. Eat real food. They don't have labels in apples or sour. Isn't that strange? Move your body. Do something fun that you want to do. My wife does one of the best exercises in the world. She walks with her best friend, Liz Cozart. They walk and talk. I can't keep up with it. But if you move your body and you're doing something cognitive, you get twice the benefit. Okay? Get good sleep. I'm working on that. That's when your body takes out the garbage. And then manage your stress. I love Tai Chi and Qigong. I'm not so good at meditation because I have a monkey brain. And then stay connected. Inform yourself. And then keep up with your health check. Know your numbers. Know your lipid profile. Know your blood pressure. Know your weight. Take care of your vision and hearing. Your brain health is in your hands. We're working on treatments for Alzheimer's. The treatments are a day late and a dollar short. Your health is in your hands. Prevention is in your hands. Restoration is in your hands. Slowing down these processes is in your hands. I want to invite Dr. Shane Foster up here with UNC Healthcare, with UNC Part E, Family Medicine and Chronic Care. Jamie Roy, she's a certified physician assistant, is interested in functional medicine. And Dr. Schwinn Johnson, with Advent Health, Hendersonville Family Medicine and Preventive Care. And to answer any questions you have, or to hear from you and your comments of what's being done in the community. Thank you for your time. I took too much of it. But this, my panel will come up here. We'll take your questions. What's the class? This is Schwinn Johnson. She's very interested in lifestyle medicine.
Thanks, Dr. Wells, for such a great presentation. It's been a very brave and very informative, very heartfelt. I really enjoyed it.
It's a little long.
But so what we know about these chronic diseases is they are all linked together. So if you reduce heart disease, diabetes, hypertension, you're actually affecting all the other diseases too. So the one thing I've done through the years is work overseas. So 40 years ago, I graduated and I worked in a small hospital in Africa, and we didn't see diabetes. I don't think I diagnosed a single case, although it was a very busy hospital. But over the years, I've been going back to visit, and the amount of chronic disease is increasing. They call these non-communicable diseases, NCDs. And so the last time I went was this past June to a busy hospital in Malawi, and they had tons of diabetes and tons of hypertension, strokes, heart attacks, along with the malaria and all the others. So these diseases are linked, and the first sort of the puzzle is why, right? So the biggest study looking at that is the Global Burden of Disease study, which has been going on for 2 decades now. It involves many countries, all the big continents. United States, we publish every other year in JAMA. The world data is published in Lancet, and the number one cause is food. So food is what's driving this, and of course we have different interpretations of what food we should be eating. We all agree we should be eating a healthy diet, and when it comes to cognitive decline and Alzheimer's, the big studies that are repeating over and over, the Chicago Health and Aging Study, the Women's Health Study from Harvard, Loma Linda has studied, it's saturated fat in our diet, saturated fat. And I like using food terms, but what they're saying is meat, dairy, eggs, right? So that's what's driving it. And in the global burden study, the big top 5 causes of food are things we aren't eating enough of: fruit, vegetables, whole grains. Whole grains we tend to get rid of if we're doing a keto diet. Nuts. Those are foods that are actually going to reduce this chronic disease burden. So that's sort of just the entry on that question. But I think everyone would agree the first food to eat is fresh green leafy vegetables.
Oh, it should be 75% of the plate now. Yes, thank you.
Dr. Rick, to get back to that, I think it's very interesting. I have a 6-year-old myself, and I've kind of watched where I started in healthcare and evolved with it. So I think it really starts at home. So a lot of you probably grandparents, and then you watch your children, and you can tell the big conversation between my in-laws. My parents are both passed, a lot of unhealthy choices at a young age. So I feel like you can live by teaching them what we know now. So a big thing that we do in our home is we talk about play. Have we moved our body enough? You're watching your grandkids. I think the big change in public school, different things, is have those conversations. How much did you guys play? You're on your tablet at school now learning, which can be really integrative and helpful for them learning, but then have boundaries and make sure they're not going home and straight to that. And then learning to spell. We're playing horse, we're playing pig. We've downloaded the EWG app and another app called the Yuka app. So it's really fun with my 6-year-old. We'll go around, and even in the past 2 weeks, he's scanning things himself going, oh, this has too much sugar. This has this. Where could I incorporate? This has more protein, Mom. And so it's making him start to think of outside of what to eat. So that's something anybody can do within the home as well, and be more, I know it's very to the point, but that's how you get on that level with children, to teach them health and things like that. And it's not to be shaming, because it's going to be a special treat, but it helps them really think outside the box and everybody be involved with it. So.
I forgot one thing. Let me take a moment. How did we get to 126 pounds of sugar? This food has been around for over 100 years. It's delicious.
The commercials on the TV.
I have not had my last Oreo, but there are fewer and further between. In this bag of Oreos, 44 cubes of sugar. That's how we get to that grocery cart over here. So you have to read your labels, know what you're eating. This is a treat once a month, not the whole bag. Okay? But this is on our shelves in the grocery store. You need to walk around the outside of the store and get the foods that you recognize that don't even have labels.
There's about 15 versions of that, so you have
Yes.
You'll get your steps in after you pick up all those trash bags and you'll burn that.
I'm going to say a few things while I've got the microphone next to me. When I was in medical school back in the early 90s, they kept telling us that we had all these great drugs for Alzheimer's in the pipeline. Things were going to change. And in my career, I have not seen that yet. So anything you can do for prevention, do it. Because so far, it's so disappointing to have people come in and you diagnose them or say, I think you have early Alzheimer's, and they say, what can you do? And the stuff that we have, other than the very newest drugs, which I still don't think are terribly effective, they don't do very much for very long. So you really have to take the bull by the horns, and I would strongly encourage you to do the things that Ora's talked about and the things that SparkPoint promotes as far as healthy living and being active and moving and using your brain.
Thank you.